looking at this, a pyramid again, pyramid, renal pyramids, and all of those collectively make up what histologic region? Medulla. And so this out here is what? And you can see where it extends down in here between the pyramids as well. And so those are renal columns, but if you look at the texture, they're consistent with the rest of the cortex. And that's why I didn't want you to make the mistake in thinking all of this is medulla, because it isn't. Okay, that's why I make that. Okay. Ureter, draining the kidney. Renal pelvis, this area here where the urine collects. Now, the urine gets there from draining from these drainage pathways, which are called calyces. And so, here's what I was trying to explain earlier. This one is draining a single pyramid. This one is draining a single pyramid. This one is draining a single pyramid. Wherever you see that, that one is draining a single pyramid. Those are all minor calyxes. But whenever two of them come together and continue draining toward the renal pelvis, then that becomes a major calyx. And you can see there's one draining that direction also. So all of those come together to form a major calyx. Okay. Now that's urine flow. Now, blood coming in, renal artery, divides into major branches called segmental arteries. The first branches of the renal artery are called segmental. So this is one, and you can see, because it's going to serve a segment of the kidney, and this one's going to serve this segment over here, and so forth. Then it branches into arteries that go up between the pyramids. See the red ones? See this red one? Mm-hmm. Okay, that's an interlobar artery. You can maybe see it better here. Interlobar artery. Okay? Then it goes up and it makes an arc over top of the pyramid, and it becomes an arcuate artery. So here you see it branching, and it makes an arc, and that's an arcuate artery. And then branches off of it, well, you can see them here, are interlobular arteries. And those are the ones that serve the nephrons. These are nephrons out here. And so the interlobular, remember, lobules are little lobes. They're components. They treat each one of these pyramid areas as a lobe. And that's why these are called interlobar, because they're between the lobes or between the pyramids. Okay? So now you have an interlobular artery, and then off of it are going to be afferent arterioles serving the nephrons. And that's what you're seeing out here. See, here's and then off of it, afferent arteriole going to a nephron. Okay? Now, draining from those are interlobular veins, draining down into an arcuate vein, which drains down into a interlobar vein, which drains down and joins a segmental vein, and the segmental veins drain into the renal vein. Just the same as we had with the arteries. Exact same thing.
And here the veins are blue again.
Always. You should have learned that in ANP1.
Well,
Arteries are red, veins are blue, always. In anatomical
there
drawings.
was something in the last, in the respiratory that...
Except with the pulmonary circulation.
Okay.
That was always the exception, even when we studied the cardiovascular system. One exception. What am I missing out on? Well, looking at this pyramid, this might help you. And see all of these things in there those striations, they represent collecting ducts. And so they're all bringing the urine down to the apex of this pyramid, and then it goes into a minor calyx. And then, of course, over here, you see this is the drainage pathways. And all of this enters the renal pelvis. Now, something I guess I haven't emphasized, all of this cutout area inside down here goes by the name of renal sinus. It includes all of these flowage passageways, but don't confuse renal sinus with the renal pelvis, which is just the funnel-like area of the ureter. But all of this hollow area is called the renal sinus. And then this over here, of course, is oh, that doesn't come out. I thought that came out. Of course, that represents the glomerulus, and an afferent arteriole and an efferent arteriole. Of course, this would be the proximal convoluted tubule, so that as the filtrate, passes out of these into the capsule, it's collected in the proximal convoluted tubule, and then, of course, it convolutes around, and these peritubular capillaries from the efferent arteriole are intimately associated with and intertwined around it. And then eventually the tubule comes back around, and this would be the distal convoluted tubule, where it comes in close contact, with the glomerulus again. And that's where the cells of macula densa are located within the walls of the distal convoluted tubule. That we talked about that earlier. But that's pretty much it, I think. Am I leaving something out?